Hello, everybody, and welcome back to Basics with Barbara. My name is Karen Midlow. I'm with Encora Health Services, and I'm here with my friend and colleague Christine Souza, who's an end-of-life doula. And we are so excited to introduce you to Barbara Karnes, who is a renowned expert in the field of end-of-life, death and dying, and hospice, and just is so gracious to share her knowledge and expertise with us every month with a little bit of basics from Barbara. We are so grateful to Encora Health Services, to Hillcrest Memorial Gardens, and Allset Person Funeral Chapel for supporting this channel so that we can bring this to you. And with that, I'm going to turn it over to Christine. Thanks, Christine.
Thank you, Karen. Thank you so much, Barbara, as always, for joining us. We really look forward to sharing this time with you. As I was preparing to meet with you, I was thinking about a conversation that I had with someone whose mother is going to be um, being admitted to the hospice any day now. And she mentioned that she was afraid of one, her mom going on hospice because of the pain medications that are often given at the end of life. And she said that she didn't want to be responsible for her mom's death. And so I was wondering if you could share about that and maybe also talk about the benefits of the medications that are used at the end of life, but also maybe exploring or expanding what does morphine actually hasten death. And I just want to mention I am so grateful for this booklet that you have shared with us, and it's called Pain at the End of Life. I use this tool often with my patients. So, Barbara, please share with us your knowledge about does morphine hasten death? Thank you.
It could. I mean, any medication can affect death. But here's the thing. First off, we need to know that dying itself is not painful. Disease causes pain. And there's a lot of diseases that don't have pain. And if the disease does not have pain, then there really isn't any need for morphine or narcotics at end of life. Ibuprofen, Advil may take the ache all over that dying creates. However, the diseases that do cause pain, that pain will intensify as death comes. And I get emails a lot, too much, saying hospice killed my mom. My mom was fine and they came on and they gave her morphine and she died. What we have to remember is a person is on hospice because they're dying. And we tend to get sidetracked into how they're dying, when bottom line is they're on hospice because they're dying. And if pain has been an issue in the illness, then that pain as death approaches will probably increase. And because of that, and the fact that the body is shutting down, it's not working right. So anything we put into that body is not going to work in the time frame or in the manner that it would work in a healthy body. So as death approaches, we often have to increase the pain medicine, the narcotic, because it's not circulating in the body in a normal way. It's lack of understanding of the dying process that I think is why I hear so often hospice killed my mom. It tells me that hospice did not do enough teaching or enough support to that family so that they could understand that what mom's doing is normal and natural, and that we want her comfortable. Our goal is not to kill her. She's dying. She's going to die without us doing anything. And so if we the caregivers, if we the professional caregivers spend the time with the family and the caregiver to teach them end of life and teach them pain management, how we do it, then I don't think when mom dies, having been on morphine, family's going to think that that's why she died. It's all 90% of our work in end of life is education, because people don't die like they do in the movies, and it's not going to be pretty. Yes, it's not going to be pretty. And yet that's what people, family, caregivers think. And when it isn't pretty, then family and caregivers think someone's doing something wrong, and it's got to be hospice.
Oh my gosh, that was amazing, Barbara. Um, that's so helpful, I think, understanding the dying process and really being able to comfort the living and knowing that they are not doing anything wrong. It's always out of, when they're supporting their loved ones, it's always out of love. And education is so important. Can you also speak a little bit, just briefly, maybe about addiction? I think some family members too feel like they're afraid that mom is going to get hooked on these pain medication. Is there a chance of someone becoming addicted to these medications at the end of life?
Their life isn't going to be long enough to become addicted. It's the person in a healthy body that takes in narcotics, that healthy body craves it. When a disease, when pain is the result of a disease, then it's the narcotic is working on the pain. Okay, let me show you this. There is a thin line in our body between no pain and pain. Should turn it around. Pain and no pain. There's this line. Our work in any kind of pain management is to find the line. And everyone's line is going to be different. So we're literally playing with the dosage to find this line. And so we increase gradually until we have a person comfortable but alert. That's the line, all right? And what happens if we pass this line and there's too much narcotic in the body? There's some changes that we look for. At first, they're drowsy and sleepy, but that can just be because the pain is gone and now they're relaxed and sleeping. So we have to look at that. And then after the sleep issue, then you're going to have little green men on the ceiling that they're going to see. And there's an agitation. When we see these changes that tell us there's too much morphine in here, there's too much, then we cut back. Then we don't give on the schedule. And the schedule's the key, because the pain is always there. We're not taking the pain away, we're covering it up. And it has to stay in the body, in the bloodstream, on a consistent basis in order to address and relieve the pain. So these are facts that people don't understand about end of life pain management. But there are signs that we look for that tell us that we've gone beyond the line, and then we cut back. So it's an observation. It's not a concrete, way. If I take 2 aspirin, my headache's going to go away. Pain medicine doesn't work like that. You have to play with it.
That is so, so helpful. I love the finger. That's a really a great tool that we can use with our loved ones and with families that we're working with. So very helpful, Barbara. And I think you hit the nail on the head, and that is that there's just such a lack of understanding for lots of reasons when people they're not hearing what they're being told on hospice, but that's why having your books is so important, because people can read your books. They are larger print, thank you very much. They are thin, and they're a book that you can, and she's got a whole plethora of books on every kind of topic. So I really invite you, she's just given you a tip of the iceberg of all of her knowledge and expertise, to check out her website, which is BK Books, B as in Barbara, K as in Carnes, books with the S, because she has multiple ones.com. And you'll not only be able to see the wealth of materials that she has written, but you will also be able to sign up for her blog. She does not spam. I love getting her blogs and reading them every week because I learn something. And I invite you all to check out Barbara's website and check out her materials, because having the knowledge is the most important thing. We are in a culture where there's just a lack of understanding. And it's not that there's not materials out there necessarily, but Barbara's materials are written in a way that a non-medical person like myself, like my kids, when I was going through the loss of my father, got. And so I invite you to do that. So, Barbara, we're so grateful for your time, that you volunteer to be here to share your knowledge and your expertise with us. And we look forward to seeing you all next month with Basics with Barbara. Have a great month.